right, so the first measurement that we're going to take for the shoulder complex is one you'll see pretty often is the shoulder flexion movement. Typically in a clinical setting, you'll see your patient within a seated chair. Most hand therapy settings don't necessarily use these mat tables that you necessarily use in school. But essentially, we're going to start by palpating and finding where we're going to set the stationary arm. And so that stationary arm is going to kind of line up to the greater tubercle of the humerus. It will be kind of just below the acromion. And then we're stationary arm. This guy is going to stay aligned with the midline of the torso. And then our movement arm is going to follow the lateral epicondyle of the humerus. And we can refer back to the PowerPoint so you can see the anatomy and the skeletal bony anatomy of where those will lie. But essentially, for that guy, you'll palpate kind of towards the bottom of the elbow of the humerus right here. And it's that bony prominence that sticks out. You'll feel it right around here. So that's where we're going to want to measure. And so from the seated position, you'll just have your patient raise their arm up as far as they can. And you'll want to make sure that they're not compensating at the torso. You might see them kind of leaning back to try to get more distance. You'll just kind of want to make sure that they're in their limits by keeping their torso straight. So here, we'll line this guy up. We want the stationary arm right here lined up with their torso, and then we're going to find that bony prominence there on the elbow, and we'll move it up. And it's always probably good practice to ask your patient if that's all they can go. I know our patient today just had a long climbing session yesterday, so they're feeling a little sore. Typically, you'll see around 180 degrees of range of motion coming all the way back up, but you'll always want to compare to their non-affected arm just to kind of get their normal. But here, if we follow to that, we'll get a measurement of about 155, which is, in this instance, pretty good. But yeah, that's how you measure shoulder flexion.